Hello, everyone. Thank you for
Hi.
joining us this
Hello.
evening.
Hello.
Hi. Thank you guys for joining us for this panel discussion called Community Conversations Navigating Cancer While Black. I'll be your facilitator for this event. I'm Shaniqua James. I am a group facilitator here at Gilda's Club, but also a clinical social worker in my regular everyday life. We have a panel of four tonight, including myself, and I'll let them introduce themselves, and you guys can go in whatever order you choose.
Hello, I am Talea Dindy. I'm a 9-year cancer survivor, and I'm also a cancer doula.
Hi, I'm Riona Berry. I am a cancer survivor 2 times, 30 years, and I'm president of the African American Breast Cancer Alliance.
Hi, I'm Susan Smith, and I am a surviving spouse of Bill Smith, who was a two-time cancer survivor, but passed when his lung cancer reached stage 4.
Thank you guys for that. So as you guys can see, we have a wonderful, incredible panel lined up tonight, very differing perspectives. So the point of this event really is what the title implies. It's navigating cancer while you're Black. Of course, like in our current cultural climate, we want to be sure that we are putting out culturally relevant information. And I think that's the purpose of this, especially with the Gilda staff and the panel that we have lined up tonight. So without further ado, we can jump right into some questions. And at the end, you guys will be able to ask questions for the panel as well. So let's just start with a very basic question. What do you guys feel like it means to have culturally relevant information related to cancer? Like what does that mean to you guys?
Well, it's Riona. I would say when we started 30 years ago, there was no culturally relevant information available for African Americans. So when we started, we decided we needed to create something specifically for Black people, for Black women, that was culturally specific and actually included Black women in this breast cancer world, because we didn't see ourselves in the magazines getting mammograms. We didn't hear about information about breast cancer affecting Black women. So we created our own brochure with the help of the American Cancer Society, and they actually helped distribute that brochure across the country.
That's amazing. That's amazing. That's important, right?
Yes.
Yeah, very important.
I think for me, it's important that we could see ourselves in the material. And I didn't do that. We didn't see a lot of that because we went through North Memorial, but that would have been very important to see ourselves represented in the marketing material. So I think it's very critical that we're able to see people that look like us going through treatment and receiving services.
Absolutely.
I agree with Susan and Riona. It's very important. When I was going through my cancer journey, I didn't see anything representing anyone that looked like me. And I think I just would have felt a little more welcomed in different spaces had I seen that and seen that I was represented as well.
Absolutely. I completely agree. I think the lack of culturally relevant information and seeing people who look like you in these cancer spaces can create an environment of some sort of biases. So that kind of leads me into my next question. What are some common biases that you guys feel that Black people have and the effects of their quality of care, especially at
I am so sorry. Let me go address that. I thought everything was shut off. I'm sorry. I'm going to mess up the tape.
Should we go ahead?
So that question, again, I'll just repeat it really quick. So what are some common biases that people have about Black people that affects their quality of care and like their potential outcome, especially as it relates to cancer?
I would have to say factoring around insurance and the ability to pay. That's definitely a huge one. You know, just wondering what kind of insurance do they have? Are they going to be able to, you know, take care of their medical bills and things like that? That's definitely one. The other one is lack of education, or assuming that someone is not educated enough to move forward and ask the right questions and things like that. The other one that I noticed is that there's a perception, I believe, that Black people can tolerate more pain than white people. And so the Black people have to suffer a little bit more before they get additional help for their healthcare concern, whatever that happens to be. So those are main ones. Really, it factors around insurance and the ability to pay. Just thinking that, you know, we have a lower educational level. And the other one is a higher pain tolerance, thinking that, you know, they can tolerate more, they're fine, they're just overreacting. And those three are very, very critical to someone's outcome.
Mm-hmm. Absolutely. Absolutely.
Yes, I agree with that. When we started, actually, we had to deal with the myths about cancer. We've heard people say, well, if you have surgery, they cut you open, the air hits it, and it'll spread all over. We had social economic issues. People were, actually women were choosing between working, taking care of their kids, putting food on the table. So going to a doctor was like bottom of the list. The other thing is too, is a lot of people believe what other people have gone through. My sister went through that and the chemo made her so sick, so don't take it. So when we get bad information from other people, it really hurts women and it hurts African American people in general, because they're going off incorrect information. And if they don't trust the medical system in the first place, they might believe some of these misinformed people. And so we have to constantly work against that because it's still happening now.
Absolutely. Absolutely. I think that's a great point, Riona. We do have to think about the mistrust that is there, not only with the biases that medical professionals might have towards Black people, but also the misinformation that people are getting from like their loved ones, friends, or whomever related to healthcare. Susan, I'd really be interested to hear your perspective on this too, especially having seen that your husband went through this. What are some biases that you feel that people have about Black people and the quality of care and like the potential outcome for that?
One bias would be we didn't have insurance. They just assumed we didn't have insurance when we were well insured. I worked at Blue Cross and Bill was a Honeywell retiree, so we had insurance. And they kind of wanted to lump us in and like demanding copays up front when typically they would bill you, especially for some treatments that are quite expensive, they would bill you. And I think it's the myth of learning who to listen to and to, I've heard that about once you have surgery, it just spreads everywhere if that air hits it. I mean, that's a common misconception that I even had. And I had to learn with the help of my husband that that is not the case. And to learn how to really ask questions and really expect answers that made sense and that were said in language you could understand. It wasn't all technical. And if there's a technical term, being bold and asking, well, you have to explain that. And if necessary, explain it again, because I think sometimes they thought that we would just come in and accept whatever. They're the doctor, we're the patient. So we would just accept whatever they said at face value without asking questions, because aren't we lucky to be having this care? And we're very much want to have a team approach. And I think a lot of people don't have that opportunity to do that, or have someone else that can advocate for them to make sure those questions are asked. But those are a few of the biases that I remember. Well, they probably wouldn't understand it, or I think Talea said something about, in terms of prescribing certain medicines, like Bill had esophageal pain. And I was there so I could hear that another patient who also had the same diagnosis, he received something called Megace, which is supposed to coat the throat. And I went back in and I was like, well, why didn't he? I'm like that anyway. Why didn't he get that? You know. So, in making sure you just advocate and ask questions. Because, like you said, Bill was he was a strong man. He was a strong man, physically strong, mentally strong. And I think they just assumed he could just, take whatever. And it's like, he's uncomfortable. He can't eat.
Those are all really good points, you guys. One common one that I hear is really with the insurance piece of it. Either they think that you don't have insurance, making you pay co-pays at the beginning, and really just treatment that other patients weren't really getting. So what ways do you guys think that we can combat some of these biases when it comes to cancer care in the Black community?
Well, really.
Oh, sorry, go ahead.
Sorry. I was just going to say, really, it's being seen as human beings. And really, I think it's on the shoulders of the people in the healthcare industry to recognize their biases, and then they work through them, because we're not coming there with these biases. They're being we're looked at a certain way, and we can't fix that because we're not the ones with those kind of biases. So it's like, those conversations have to be had within the healthcare industry, healthcare community. They have to recognize the way that they're responding to people and treating people that do not look like them. So, and I think part of that is just having those conversations up front. When you get a new patient, sit down and talk to them, get to know them as if we are human beings. So sit down and talk to us, get to know us, don't make assumptions, and, learn about what we're going through and what led us up to this point. And I think then it'll be a little bit easier, for people to kind of work through those biases. So really, I think that there's more training to be had for the healthcare professionals.
That's true. Go ahead.
Oh, you're good.
Okay. The other thing is, we talk about self-advocacy. We have people who have the ability to advocate for themselves and those who don't. And it also means that as a community, we need to educate our community on how to self-advocate, because we are responsible for our health too. So we should be able to walk into the doctor's office and be able to understand what they're talking about. Because when I talk to some women, fear is driving their behavior. So I don't want to talk about it. I don't want to do this. They're going to do this to me. So it's kind of like, we have to be able to say, okay, let's get a plan going here. This is something that you need to do. How to be a good patient, how to be an informed patient, because all doctors and nurses aren't there to take advantage of us or hurt us. So we have to get over that fear and that sense of mistrust that we can also create within ourselves. And when we say get informed, when there's information out there, I mean, the internet is full of information. Get the information to learn about cancer. Get the facts, get it straight from the horse's mouth. Do not assume that so-and-so has all the information, because when you pass on bad information, we get bad results.
Absolutely.
I totally agree with both what Talea and Riona said. And I'd like to add that advocacy, definitely. And having resources within our community. For instance, we have a lot of older friends, and I've gone on appointments with some to doctor's appointments. I like the idea of there being a cancer doula. That's wonderful, because a lot of people, such as me, I'm living alone now. So when you get a diagnosis like that, my husband, first few meetings he could be engaged, but after treatment started, you're fighting. So you don't need to just have to decipher through that. And I also feel that we have to advocate for ourselves, and we can't expect the medical community has to meet us. They need to get educated too, because too often we are asked to explain the bias and how they can overcome it. That's on them. But I agree with what you said, Riona. We have to be educated. We need to understand what our benefits are.
Yes.
And the best time to do that is before there's a crisis.
Yes.
And that's what I worked in the insurance field, and trust me, it's not easy even when you work there to understand some of it. And making sure you have resources that you can talk to and people that can go with you to appointments. That's so very important.
It really
and above all, knowing you have a right to ask questions and you have a right to withhold treatment until you understand what's going on. No one should feel that they, should be backed in the corner like this is life and death now. No, there should have been some discussion prior to that. And I appreciate where we went, because they did take a team approach, but we asked for that. I don't know if that's the rule, but we did ask for that. We wanted to know everybody that was going to be dealing with my husband.
Yeah. And I think in my own experience, just not having gone through cancer. So my mother passed from breast cancer herself, and I was the only caregiver for her at that time. And I think I don't feel like I had the necessary information or resources to really be able to advocate for her the way that I felt that I needed to. And a lot of times it was incredibly intimidating going into those doctor's appointments, because again, there is that notion that there's a differential in power, right? This is the doctor. I'm not even the person with cancer. It's my mother's appointment. So there was always this unsaid sort of power differential that really intimidated me. So when you guys speak about self-advocacy, I completely agree. And my mother was the person, she did not hold back. If she had a problem, if she had a question, she was going to ask it. You were going to hear about it. And I think that's really what self-advocacy looked like for her. And when we talk about that, I'd be interested to know, what do you guys really define as self-advocacy, and how does that look for you when we're talking about cancer or like dealing with healthcare professionals? And in what ways can we really challenge some of these healthcare biases by using self-advocacy?
I would have to say speaking up for yourself, and just being honest about where you are, and saying, hey, I don't understand that. Can you repeat that in a way that I can understand it? Being really clear about the quality of life that you want, after your cancer treatment. Understanding your cancer treatment options, that's very important. Understanding what the potential side effects will be for those particular options. Doing the research, figuring out, what kind of cancer do I really have? What are the best outcomes for this? What are the best treatment options? Asking questions, forming partnerships with your oncologist, taking notes. All of those things, bringing someone with you, because you're not going to remember everything. Preparing your questions ahead of time so that you can take good advantage of the small window that you have with your oncologist and healthcare team. And really, like I just said, speaking up for yourself. If something doesn't feel right, if you're not clear on something, don't be afraid. It's completely okay.
Absolutely.
Yes, definitely.
Yeah, that was pretty thorough. that was very thorough.
Yes.
All of that.
Yeah.
And prayer.
Yes. I mean, faith is that I tell women that you will be all right. you know, because this is a day-by-day process when you're being diagnosed and treated for cancer. And it becomes overwhelming to think, I have to have surgery, I have to have chemo, I have to have this, and how long am I going to live? And it's like, slow it down, just go day by day, listen to the doctor, because when fear is actually driving the train, people sometimes run off the rails. And we've had women say, I'm not going to do anything. And they don't. And then trying to explain to them, you have two choices, you know, go through these treatments. Yes, they will make you sick. You will not feel good. You'll lose your hair. Your skin will change. But those are symptoms that will subside after treatment is over, because the goal here is living. So we have to be very, very careful about how we share information and how they understand the information, because we want people to be able to live. And even no matter how long they have, we don't know how long that is. That's not our job. But to get through that day-to-day process, it could be 6 months of treatment, it could be a year of treatment, but it's going to be hard, and just let's deal with that.
Absolutely. Absolutely. I think that's an awesome point, Riona. And it kind of segues us into our next question is, how do people cope with having this cancer diagnosis, especially if it's recently diagnosed? And what sort of resources or information can we give out for like mental health? And how do we advocate for our mental health when we're dealing with a cancer diagnosis? I mean, I think it's one of those things that's really left out when we talk about cancer sometimes, because we're dealing with such a huge diagnosis when we talk about cancer, but it's also one of the important things, right? Like Riona said, we want you to live. Like, we're doing this because we want you to live. So that's a huge battle for people. So in what ways, what information or advice can you give people who are having to cope with not only their cancer diagnosis, but mental health as well?
For Bill and I, we both went to Gilda's Club. We also became active with other cancer groups for husbands and wives who had cancer. We also were very active in our church. So I believe that holistically, you need to take care of your mind, body, and spirit as best you can when you're going through cancer. And even though there were times when he didn't feel like going to church because he was sick, we still live streamed and stayed connected. I think it's very important that you don't isolate, but I also believe it was very important to make sure that I gave him space as well. Because I can walk with him on this journey, but it's not necessarily my journey, because it's very important that I honored that to give him the room to make decisions and not make decisions based on how I may feel. Because it's very good to identify also what quality of life means to you, especially when you're going through various treatments.
Yes. Because
some of the surgeries that he had, it prohibited him from doing things. And I would ask him, I said, how are you doing? And that was how is the quality of life going? You know, are you feeling like you can do stuff? He said, yeah, I still want to do this. I can do this. And just trying to remain as positive as possible and get your family engaged as much as you can. I know that's up to every individual, because some people, when they have a diagnosis, they're very private. I had a friend that went through breast cancer, and I didn't even find out till she was on the other side of her treatment. And it wasn't a personal indictment, it was a personal choice, and I respected that. I still loved her, and I was happy that she got the care that she needed. And I think she even went to your facility, your agency, Riona. So I was very glad for that. But to build a team of supporters, and that might not be everybody in your circle of friends, and that's okay. But you just need support.
Right.
Yeah, because you have to respect the fact that people are very private too. When they're going through this, sometimes people can deal with it by coming into themselves so they can figure out what their path is. And you have to honor that too. but make sure that it doesn't go into to a depression or a complete withdrawal. So it's really understanding.
Definitely. Yeah. Right now with the African American Breast Cancer Alliance, with Talela being part of our organization, she has been a wonderful resource, and sharing that information with her about new clients that we receive. It's so helpful because she's the first cancer doula we've ever heard of before. You know?
I never heard of that.
Yeah, it's just wonderful that she started this organization. And so for us to be able to share information about a Black woman that has gone through cancer and is able to help walk other people through it, it's wonderful. And we also say, get your information about mental health or emotional health needs from the clinic or the hospital. I mean, those services are there and they're included in the insurance plan.
That's
the
right.
other part is we have the NAMI, National Association of Mental
Mental health. Yeah.
Health. Yes.
Mhm.
Contact them. If you need a therapist, because there's sometimes when we were going through chemo, we would end up having anticipatory vomiting. And it's like as soon as we saw the building or as soon as we walked into the doctor's office, the smell of cancer treatment hit us, and it was like, whoop, there I go. So a friend of mine, she said she had to have a therapist to help her get through the chemo because it was so hard. She couldn't disassociate herself from the cancer environment, the treatment environment. And there's no shame in helping, looking for help and seeking mental health and emotional health. And Black people, and here we talk about it all the time, in our group, we call it the strong Black woman syndrome.
Mhm.
That has taken us down a lot of times because we're suffering in silence a lot of time, thinking I can do this by myself. No, you can't, you know. And even if they are handling it by themselves and they finish chemo, sometime 5-10 years later, boom, something hits them. Maybe a friend or family member was diagnosed, and all those feelings come back. And so it's really hard. Cancer is not an easy thing to go through. You know, it's not quick and easy and over within a certain period of time. But this is part of our lives now. So we have to deal with it
Yes.
in the best way we can. And that means reach for help.
Absolutely. Absolutely.
And I agree with everything Susan and Riona said. I just want to add that being patient with yourself and the people that are around you and supporting you is very critical, because we're all trying to figure out how to navigate this thing, you know, especially if you've never been through it before. Patience is key.
Right.
And just being honest with yourself about how you're truly feeling. You don't have to pretend to be like you're happy and positive when you're not. It's okay. There's going to be a range of emotions that you may experience, and that is completely normal.
Yes.
True. That's very true.
So Leah, I love that you said that. I'm reminiscing on my own experience with my mother again. And I can look back and say, yeah, she really was depressed. And even though I was kind of pushing her to seek help, I think a lot of the stigma around mental health, and Riona, you put it perfectly, like that strong Black woman syndrome is a real thing. And she had it for sure. Because she would always say, and I respect
How
that.
we get through life.
Right.
Yeah.
It is. And she would always say, God got me. I'll get through it. It's fine.
Right.
Like, that is absolutely true, Mom. Like, you might believe that, but also there are resources available to you to help you get through this, because you don't have to suffer in silence. So I can't stress enough to people to really recognize the signs of when you're having a difficult time coping with the things that you're going through. Because like you guys said already before, it's a big diagnosis and you don't have to do it alone. There are resources available for you, whether that be a support group at Gilda's, or if you find an individual therapist or a cancer doula, they're out there, and always encouraging people to look for those resources and not be afraid to look for those resources. So I think that was perfectly said. Susan, you mentioned something about an holistic approach to really coping and dealing with mental health. And there seems to be a stigma with mental health in general. How do you guys think that we can really combat that stigma, not only around like the holistic approach to dealing with cancer, but mental health in general?
Well, one thing that I noticed when Bill received the diagnosis, when you're faith-based, automatically some of your spiritual friends kick right in, and prayer is wonderful. But God, I believe, also gifted people to help us on this journey.
Yes.
Physically, mentally, spiritually, and emotionally. And they're wonderful therapists. Bill and I have always believed in going to therapy. We are the odd ducks a lot of times in our family or among our friends, and I'm okay with that because I have learned how to be content within myself and learn how to advocate for myself and to also know when I need help.
Yes.
I believe all of that, and that's when I say holistic. It's whatever you need for whatever part of your body is not doing well your spirit. You go to that expert. Cancer is not a spiritual diagnosis.
Right.
It's a medical diagnosis. It can be through prayer healed. I'm not going to discount that. That doesn't happen for everybody. So I believe in going to talented people who have those God-gifted skills. And I'm a proponent in therapy,
yes.
of therapy. I mean, it's a part of self-care for me.
Yes.
And that's not a popular, I think it's getting better. I think it's getting better, and I think what we can do to promote that more is to talk about it. And that's why I share my experience. I share my recovery experience. I share my therapy. I don't publish it in the Star Trib, but when I'm led to when I meet someone and I see that they're struggling, have you tried this? This is my experience. And I think we have, as African Americans, have to do more of that because so much is hidden. I remember my husband, he would talk. I was surprised at the number of Black men that never had prostate checks.
Yes.
Bill was like, you need to get that check. You need to do that. And, I admired him for him. So I got a wealth of information by watching him go through not one diagnosis, but two diagnoses. Yeah, you have to get the help. There's nothing wrong with getting the help that you need.
Absolutely. Absolutely.
And we have to have meetings at churches too, I think. Offer support groups so that they get used to, seeing that, yeah, this is a group that, yeah.
Rihanna, you were going to say something?
Sorry.
Well, yes, with Susan and Bill, that's one thing. They worked as a team, and that's great because you need to have a team approach to this. But we found with a lot of men, they have the strong Black man syndrome too. And they're terrible because a woman, the wife or girlfriend, she's usually bugging him, go get checked. And he's like, no, it's just a pulled muscle. No, they're having prostate issues. They're having bleeding issues. And then next thing you know, finally go to the doctor and they're in stage 4 cancer. So this is the type of thing that's denial in a sense, because the old joke is every time I go to the doctor, he finds something wrong. But that's the whole thing about being proactive, about getting annual checkups. And we have to constantly tell people, it starts with you, because the doctor might be 25 miles away, and well, with telemedicine, maybe now we can win to a doctor, but you know, it's still, you still have to make the phone call. You still have to say something's happening here. I want to get checked. And it's like, it's sad that so many people die of fear and ignorance, because something that could have been a stage 1 cancer that's progressed years later into a stage 4 cancer didn't have to happen. And it's the sad story that happens to a lot of people. And it's something that with Bill and Susan, they work together on this, but we have to do that, because if you have a child, you're going to advocate for that child,
Right.
for sure. So it's like, why not take care of ourselves just as well as we would our children?
And it was pretty easy. With Bill was always good. I hear women say their husbands don't go to the doctor. Bill he would notice things about my body. I'm like, how'd you even know? He said, yeah, something's not right. I'm like, okay, you know, but that's because that is hard, because I had a childhood friend. By the time he engaged his sister, who was an oncology nurse, he had 2 or 3 days to live. And that just shocks the whole family's in like disbelief. But it's that denial, that deep denial, strong, and fear. It's fear too.
It's fear.
Because we are immortal. We're not immortal. We're mortal.
Right.
Yeah.
Do you think that fear is just the fear that there may be something wrong? What do you guys think that fear is? Where does that really come from?
Fear of hearing that word, I have cancer.
It brings it to a reality, you know, that, oh, I am mortal. Oh, I can die. Oh,
Right.
I can get sick.
Right. Exactly.
And actually, when people ask, well, how long do I have to live? I don't know, for me, I don't think that's a good question to ask, because doctors can give you a, you know, timeline, well, between 3-6 months, 3-6 years. It depends on the disease. It depends on how it's being treated. It depends on how far it's progressed. And sometimes they're very accurate in the ballpark figures, simply because if it's a stage 4, yeah, they can pretty much predict. Yeah. And it's like when people say, even though the doctor said this was my timeline, what do we say? Dr. God talks, tells me, you know. So that's that sense of faith that we have to kind of have too when we're going through a cancer treatment. And people do ask us, well, how long do you think I have to live? Well, we're survivors ourselves. We're not doctors, so we don't give medical information. It's kind of like, that's the process people have to develop with their own medical team.
I think a lot of it has to do with the fear related to the stigma of cancer and how that information is communicated, how cancer is discussed, certain words that are used to describe cancer. All of those things create fear, because the language about cancer is fear-based. There's a lot of words like fight, battle, all of those things that provoke fear. And the other thing I'd have to say is also, it's the fear of not knowing what's to come. You know, there's going to be a new normal, but I don't know what that is. I don't know how I'm going to adjust to that. You know, you're going along living your life, and all of a sudden you have this thing that's shown up and it's taken over. Absolutely. Not knowing how to navigate that is fearful. It's scary, you know, for most people, especially if you've never had a family member or a friend that has, you know, had cancer before.
Right.
Absolutely. I think that's a great point.
And the unknown.
Yeah. Yeah. And I think that leads us into our next question as well. So what information or resources would you offer to someone going through this experience who's new to it, or who just doesn't have that information? What would you tell them? You can base this off of your own experience. Like, do you have a specific experience of things that you wish that you would have known going into your cancer journeys? What would you offer others?
I wish I had known ABCA. I wish I had known about, I wish there would have been more diverse support groups at the time. I went to one support group and I just had to leave. And it was just because of the mindset of the people that were there. Of course, there was no one that looked like me that was there. And no disrespect, a lot of the people there were older people. So they had a different perspective on their cancer journey. Whereas being a younger person, I wanted to live. I didn't want to sit there and talk about, potentially dying, because that's not what was in my mind at the time. My mind was, how am I going to get through this? And how can I prepare myself mentally for this? So that's one thing, is just more support groups, more well-rounded education and information, knowing what to look for on the internet. For example, there's a lot of people out there trying to sell these miracles, drink this juice and you'll be cured of cancer. And that's simply not true. Just knowing what to look for. Get your information from websites that end in .edu. Those are usually university white papers. Just be mindful of the kind of information that you're bringing in, because that's what's going in your mind, and your mind and your body work together. So you have to be careful what you put in your mind. So.
Right.
Totally agree. I would say that information from reputable sources, they cautioned me. In fact, I was given a list of websites to go to, because they said, you can really research this. And they cautioned me. They said, there's a lot of information out there. We'll give you information, research from that basis, because you can overwhelm yourself as well. Because I remember one night, I thought I had it all figured out. I had the game plan and everything, and it's just too much for me. So with caution, you need to research. I always research, what questions should I ask? What should I be asking? The other thing is to be in an environment where you feel safe and secure and nurtured, and there are people that look like you. I think we need to have more support groups in communities of color, because we're fortunate we had cars we could go out to Gilda's. Gilda's is far from the community where we live. And I don't know of anyone. I tell people about Gilda's and they're surprised that it exists. So I think more groups, more partnerships with places like Gilda or North Memorial, with clinics that are located in St. Paul or in North Minneapolis, South Minneapolis, where communities of colors are. And then always having a pool of people you can call that maybe can even go with you if you don't have someone to attend your first meetings, your first few meetings, or go on that journey with you. Just making it a much more easier access for quality health care.
Absolutely.
Yes, I think since we started 30 years ago, all these issues we dealt with then, and we're still dealing with them. And one of the other things we did after we created our brochure about breast cancer in Black women, we created a guide, and we took all the information from all of our survivor members and asked, what would you tell a lady that's going through this? We put down all of our practical information. We shared our own personal stories so that people don't feel as if they're going through this all by themselves. There are so many, because first of all, we didn't know how many other women had breast cancer before we were diagnosed, because Black folks just didn't talk about cancer. You don't talk about the big C.
Mhm.
So when we decide, okay, we're going to bust this bubble open because too many Black people are dying from cancer. So support groups, we need a support group. And why didn't we have a support group? So we went through all those issues, why Black women didn't join support groups. So when we find all these particular issues that we were dealing with, it's like, okay, we need to put together information to help combat that, because lack of information was killing us too.
Mhm. Mhm.
And it became something that we learned. Cancer is not just a personal disease, it's a family disease and it's a community disease.
Mhm.
And when we are losing so many sisters and brothers from cancer unnecessarily, that's something we have to keep working on. I mean, still keep working on, because a lot of people think, well, breast cancer was an old woman's disease. No, I mean, look how many 20-year-olds that have breast cancer now.
Right.
And look how many men have been diagnosed with breast
With
cancer.
breast cancer too. Yeah.
So the fact that cancer has, like we all know, cancer has no discrimination when it comes to, I got you. You know,
Right.
it's definitely all classes, all colors, all sizes, all shapes, all education levels, all social and economic levels. Cancer doesn't care. You know? So
That's
we
true.
have to kind of get over and actually be able to explain what cancer is, because it's a mystery. I mean, we don't understand it. So
Mhm.
Cancer 101, you know, we have to
Right.
understand.
Right. And a lot of it is preventative measures too.
Yes. Yes.
How can you protect yourself, or better eating habits, whatever, what can we do? Because a lot of it, our environments are very complex now.
Absolutely.
You know, so we all, it's going to touch all of us.
Absolutely. I agree with everything that you guys just said, and I really want to reiterate the importance of really getting the right information, the relevant information, the important information. And like you guys have already said as well, that burden really does fall on the healthcare providers who are providing the care for cancer patients. Cancer patients, when they're getting these diagnoses, are already very overwhelmed with things, and these sort of resources and information should be able to be offered when you're going through this. And I think that comes with getting more providers who are somewhat culturally competent. I know you can never like have full competency when it comes to culture, but like an inkling of it would be helpful. Even if that looks like having more providers in oncology who are people of color and can like really relate to the patients that they serve. I think that's going to be a really important piece of it too. And again, like you guys said, self-advocacy with people really calling out your providers when they see those biases, and kind of challenging the way that they're giving you that care, because you deserve good care. Like we do deserve to live. Cancer does not have to be the end of us. And really recognizing that. So I think this was an awesome conversation about cancer. And I want to be cognizant of everyone's time. So are there any final thoughts, any final things that you guys want to put out there, any information, any advice that you would have for anyone going through this right now, any words of wisdom, affirmations, whatever it may be? What do you guys have?
Well, you mentioned the cultural competency, and that's something that we've been working on. The American Cancer Society has been working on, Minnesota Department of Health has been working on, and it's still kind of at the same level. But what we're finding, and we also found that if a doctor or the oncology nurse, the team, the social worker would ask a person of color, would you be interested in contacting or having resources from a community of color organization or agency, and have that information available? Because we know, like Talea said, the support group she went to was not friendly for her. She did not enjoy it. So if they could just say, we need more information about these community of color resources, so that when a Black person asks a question about something, we don't want to hear a doctor say, well, I don't know, you know.
Right.
We want to know that we are included in this big picture in the community of cancer.
Mm-hmm.
And so to be able that to tell us and share with us, you know, you might want to contact On the Other Side. You might want to contact the African American Breast Cancer Alliance, because otherwise, you know, we will leave the office feeling just as confused,
Mm-hmm.
and almost as if, you know, a letdown.
Mm-hmm.
There's no place for me to go,
Mm-hmm.
no one to talk to, you know.
Mm-hmm.
I know that I would say, in addition to what Riona is saying and what we said here, that it's one thing to have a group. I know when I researched and looked for cancer support groups, I didn't see any on the internet.
Mm-hmm.
So whenever those are created, there needs to be a database of resources.
Yes.
Absolutely.
Mm-hmm.
Because there's sometimes they're there, but only through word of mouth.
Mm-hmm.
You may not even be aware of it. It was just like when I went into recovery, I'm like, where are the Black people? I didn't know. You tell me I'm the only one with this problem in the state of Minnesota? You know, so but I'm resourceful like that. I'm like, no, that can't be. I'll find it. But not everybody is, and especially when you have a diagnosis like cancer. You know,
Right.
you just you need help. And it doesn't need to be where you have to dig through everything to get it. This is information. If they could tell me at North Memorial about Breath of Hope and Gilda's Club,
Mm-hmm.
I should have heard about your agency, Riona.
Mm-hmm.
Mm-hmm.
That should have been on that list too.
Mm-hmm.
Yeah, yeah. And we worked with all the community hospitals and clinics and care centers for the last 30 years. But it's like with the turnover in personnel, the doctors, the nurses, that information that was there for 5 years, that person leaves, bloop, it drops off the edge, you know, and then the new person, oh, I don't know.
Mm-hmm.
So it's like, yes, how do we keep agencies of color, organizations of color that help people with cancer relevant and in the loop?
Mm-hmm.
Because we could receive so many more referrals from the clinics and hospitals. And I've been working with the Park Nicollet Community Cancer Control Program for years, and it's still going on. It's still how to reach the communities of color, how to integrate our information into the system. And the thing we found out, it is an overall medical system change.
Mm-hmm.
So you might come to a meeting, but you're not at the table to make those changes.
Mm-hmm.
And that's just part of the program, you know, right now.
Throw the whole healthcare system away.
Right. Exactly.
Well, you know,
Yeah.
get a system that's easy to input. You know, you all they now have MyChart and other systems
Mm-hmm.
that talk across the line. So it's not a big leap to have a community-based one where they can update.
Right.
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 Yeah.
And that's why I feel like roles like Talea's is going to be incredibly important.
Very key.
Even though she's the only cancer doula I've ever met, that's important. She's been through it. Like, she can give you these resources. She can really speak to her experience, and some of the things that other people who are Black and going through a cancer diagnosis may experience as well, and really help guide them through that situation. So I think that's going to be important, especially moving forward. But I agree with you, Riona. I feel like, and I can speak to my own experience. I had no idea about your organization until after the passing of my mother, when I really felt like I needed that extra support. That's how I found it, and I'm like, that would have been helpful when we were like in the rustle of things. So I agree with what you said.
A lot of opportunities for Talea. You have to reproduce your gifts.
Yeah, I'm working on it.
That's good. That's excellent. That's another way of doing it. Start teaching other people.
That's right.
Right.
That's right.
Right.
I hope to have a program together where I can train other people. And, you know, I
Right.
really want people that have been on the cancer journey, though, because I feel
Right.
like there's just something there that someone who has not been on that journey can't provide. And it's not to say
Right.
that they can't do it and they can't do a great job at it, but there's just that added bonus of having that kind of connection. So,
Yes.
and I think Susan and Riona, you guys both have made really good points. I just want to add that in closing, it's important for the patient and the healthcare provider to look at their relationship as a partnership. And I think that will really help with a lot of these issues that we're seeing, because it is a partnership. You have to have good communication. You have to have good understanding. You have to be on the same page. But in order to do that, you have to talk through things just like you would any other relationship. So that's just what I want to put on everyone's mind, is that, you know, look at it as a partnership, and then maybe, you know, we'll start to approach things in each other a little bit differently.
Right.
Excellent. Yeah. And that happens at those very first meetings, and that's how we approached it too. Look, I don't know. I don't know anything about this, but I do know that my husband and I, we are willing. We want to work to take a team approach, because you are all on our team. And I think that helped. His outcome wasn't what I would have liked, but I also said that we also are people of faith, and no one knows your time but God. And he did the best he could do. We sought help, advocated, and, you know, there's still something in the back of my mind that said, did I get all the help that I thought that I was supposed to get? But I have to move forward. But I'll throw that out there, that no one else have to go through that, have any second doubt, and can say without a shadow of a doubt that disparity didn't play or bias didn't play a part. And going forward, I hope that conversations like this will help. Will help.
Yes.
Absolutely. And I feel like even just sitting here in this conversation, they have already learned so much more stuff that I didn't know before. So hopefully this will help people currently going through it who have a recent diagnosis. So with that being said, I do want to close out and give some time for questions, but thank you guys so much. You guys are doing the good work out here in these streets when it comes to being Black and navigating cancer. So thank you so much for being a part of this. It's amazing.
Thank you.
Thank you for the opportunity.
Thank you.
All right.